Hi everyone, my name is Diana Heggie and I'm the Chair of the Board of Peninsula Health. It is my great pleasure to welcome you all to our 2021 Annual General Meeting and Community Forum. Thank you for joining us online again this year. We were hoping and planning to hold this year's event in our new academic and research building, the Nunrangu Centre at Frankston Hospital. But due to the current situation of COVID, we are unable to do so. It is my sincere hope that we will be able to welcome you all back in person to our 2022 AGM at the end of this year. Before we start the formal proceedings, I would like to acknowledge the Aboriginal and Torres Strait Islander people as the first peoples and traditional owners and custodians of this land. We pay our respects to the ancestors of this country, elders, knowledge holders, and leaders past, present and emerging. We extend that respect to all Aboriginal and Torres Strait Islander people, and we at Peninsula Health acknowledge the local traditional owners, the Boonwurrung and the people of the Kulin Nation. I would also like to acknowledge representatives from the Mornington Shire Council and Frankston City Council, representatives from our partners Monash University, Deakin University, La Trobe, Chisholm Institute and Homesland TAFE, and my fellow board members, and also the CEO of Peninsula Health, Felicity Top, members of the executive team, staff, volunteers and friends, members of the community who have also joined us online today. At the conclusion of this AGM, we will hold our community forum, which is an opportunity for you to ask questions and provide feedback on our services. There will be more details on this in a few minutes. As has become the normal in this online world, we are recording today's AGM, which will be made available afterwards to everyone on our website, as well as through the internet for all Peninsula Health staff. And now to start the official AGM proceedings. The minutes from the 2020 Annual General Meeting have been approved and accepted prior to today's online meeting. The makeup of the Board of Directors has changed slightly in the last 12 months. Dr. Nathan Pinksier completed his second 3-year term in June last year, having joined us in 2015. I would like to thank Nathan for his very valuable contribution and the expertise he provided to Peninsula Health over the 6-year period. Professor Mark Frydenberg has filled the vacant position when he came onto the board on the 1st of July last year. Mark is a member of the Council of the Royal Australasian College of Surgeons and is the chair of the Health and Policy and Advocacy Committee. He also holds the position of the academic chair of the Urology at Cabrini Institute at Cabrini Health. He holds professional positions at Monash University within the Department of Surgery, Faculty of Anatomy and Developmental Biology and the School of Public Health and Preventative Medicine. Welcome, Mark. I would also like to acknowledge all our existing board members: Alison Smith, Rita Kincotta, Alison Dwyer, Karen Corrie, Kirsten Mander, Sylvia Hadjantonia and Hamish Park. I would like to thank the board members for their contributions over the last year, and I look forward to continuing working with you for the benefit of our community. Now to my report for 2021. For the financial year ended the 30th of June 2021, Peninsula Health's operating revenue was $755,170,000. Our operating expenses were $754,989,000, which shows a small surplus of $181,000. Once again, the reporting period presented numerous challenges for all public health services in managing the ongoing COVID pandemic. Our target was to deliver a balanced budget, and with the challenges described, the small surplus is a good result. Our Executive Director of Finance, Pranay Lodhia, will have more detail on this in a moment. Our financial statements have received an unqualified audit report from the Victorian Auditor General and fully comply with the Victorian Government's financial management framework. You can review the full financial statements in our annual report, which is available today on our website. The past year has been another truly challenging one for all our health services, our staff, our volunteers and our community. The reporting period for our annual report included the second wave of COVID, as well as the subsequent waves and lockdowns up to the 30th of June last year. As we look back on the last 12 months since we last held our AGM, It is a chance to reflect on the full impact of the pandemic and how we are responding as an organisation to ensure each and every person receives the best of care while at Peninsula Health. Our knowledge of COVID-19 and the health response to that has been a constantly evolving feature of the last year. Much like the virus itself and its associated variants, through treatments, vaccinations, and improved prevention control measures, we are in a far better position than we were during the first year of the pandemic. During the many changes to our models of care, COVID strategies and vaccinations, our staff have been unwavering in their commitment to provide the best care for our community. As board chair, I am extremely proud of this great organisation. Together, we have navigated some volatile and difficult moments in 2021. With each challenge, the teams across Peninsula Health have responded magnificently. Working long hours in tiring and stressful conditions, often in full PPE, is hard at the best of times. And it's even more challenging in a long-lasting pandemic, now stretching over 2 years. Many of our people have been and continue to be redeployed in areas they were initially unfamiliar with, and yet they have taken on these new challenges and really excelled. Whether from home or in the office, our non-clinical staff have been unwavering in providing vital support to those fighting the pandemic on the front line. On behalf of the board, I would like to acknowledge the tremendous work of all our staff. Your efforts to continue to keep the virus at bay while maintaining the commitment, professionalism and care you bring every hour of every day for our patients, clients and our local community does not go unnoticed. Thank you for your extraordinary work and your continued professionalism. I would also like to acknowledge and thank the executive team and our CEO, Felicity. Felicity and the executive team continue to work tirelessly for this organisation in leading our response to the pandemic. In addition to this, in the midst of this health crisis, they have managed to maintain the momentum on many key aspects of our 5-year strategic plan, something I know Felicity will talk about a bit later. Finally, to the more than 7,000 people who have selflessly invested their time and expertise with us for the betterment of Peninsula Health and the local community, thank you. Our volunteers, auxiliaries and consumer representatives are critical to our success as a health service, and I truly hope we can welcome you all back physically in some capacity at the appropriate and safe time this year. This concludes my chairperson's report for the year, and I would now like to welcome our Executive Director of Finance, Prenée Lodier, who joined us just last month to deliver the financial report. Thank you, Prenée.
Thank you, Diana. The hazards of remote working. Good morning, everyone. Can I first acknowledge Rochelle Anstey, who was the Chief Financial Officer before me, and thank her for her excellent stewardship and leadership of finance at Peninsula Health during her time here. It was a positive year for Peninsula Health with growth in turnover, an increase in investment and notable future capital commitments, all helping to contribute to a favourable result. As Diana mentioned, for the 2021 financial year, we recorded a surplus of $181,000, which in an extremely challenging year is a pleasing outcome for the health service. Once again, the COVID-19 pandemic was a key factor which had to be negotiated in the reporting period as we oversaw the single most material shift to this organization's operations, affecting almost every item on its operating statement. The health service was faced with a number of unprecedented challenges, especially during the state's second wave. Despite difficulties faced, we made a number of key capital commitments for the future. Notably, $7.3 million was committed to the Nanranga Centre, $801,000 was spent on the new Cancer and Clinical Trials Hub at Rosebud, $938,000 has been committed to the new mental health and AOD co-located facility in Frankston. We have also invested heavily in imaging services for the community, spending $450,000 to upgrade one of the MRI machines at Frankston and $319,000 for digital radiography improvements in medical imaging. The pandemic response has also seen us invest significantly in direct services for the community. $2.28 million was spent on capital expenditure to aid our response in caring for our community across Frankston and Mornington Peninsula. Overall, our investment has grown by $1.885 million to $14.724 million. It's particularly pleasing to see stability in the balance sheet ratio as health service returns to a small surplus following last year's deficit. However, some other points to note: we continue to grow our work from home program to ensure that all staff who needed to work from home were able to do so with the very latest technology to ensure we maintain efficiency levels. At different times during the financial year, we were forced to defer elective surgery and reduce activity, which had an impact on the financial performance of the organisation. Operational and staffing costs increased to accommodate COVID-19 vaccination program as we ensured this critical work was undertaken for our community. Finally, we are expecting the Omicron wave of the pandemic, which we are currently experiencing along with the resulting Code Brown, to have an impact on the 21-22 financial performance of the organisation, which we will be finalising in the coming months. There's far more detail on Peninsula Health's financial position for the reporting period up to and including 30th June 2021 in the annual report, which is available online through our website. Thank you, and I would like to now hand over to Felicity Top for the CEO's report. Felicity.
Thank you, Pranay, and good morning, everyone. I'm absolutely delighted to be here today as the Chief Executive of Peninsula Health. Before I start, I would like to take this opportunity to acknowledge past and present board directors who are with us today, community supporters and donors who do so much for our organisation, even during these difficult times through the pandemic, our incredible staff at all our sites across Frankston, the Mornington Peninsula, and of course our MEPACS team over at Chelsea Heights, and our volunteers and consumer representatives who we really have missed you over these last couple of years, and we're going to do our very best to get you back into our service very soon. I'd also like to acknowledge our strong and productive relationships with government, federal, state and local, as well as the Department of Health, other healthcare providers, our partnering universities and TAFEs. I thank you all for your contribution to Peninsula Health. We'll shortly have our community forum, which is always my favourite part of the AGM, I must say, where we invite everyone to ask questions of me and the executive team. I'm sure most of you are familiar with the technology, but there is a question box down the bottom right-hand side of the screen, and I encourage people to ask me questions or the executive team questions, and we'll get to them as soon towards the end of our program. But before I start on my report, on what's ahead of us this year and some of the achievements of last year, I want to acknowledge the 80th birthday of Frankston Hospital. Our 80th birthday was actually towards the end of last year, and with all the issues resulting with COVID, we had a soft launch of the 80th birthday to celebrate at a market on social media. But we thought it was very fitting today to just take a moment to share with you Frankston Hospital and its 80th birthday.
Frankston Hospital has always been at the centre of the community. From its first starting in 1941 as a 30-bed ward hospital, and it's come to be a thriving, caring 450-bed hospital. It covers a huge radius and a huge amount of people. It is really the birth really of Frankston. The impact on Frankston Hospital in the community has been huge.
I've had the tremendous privilege of being a pink lady at Frankston Hospital for 7 years now, and in that time I have met many lovely people and had the opportunity to brighten up their lives, and many patients too. The Pink Ladies have played a prominent role in the development of Frankston Hospital since 1968. A lovely lady by the name of Edna Vincent, she established the Pink Ladies Auxiliary, and her idea was to raise funds for the hospital. And so she put it to them at that time, could she do this? And so she did, and what she did was get trestles. And the hospital at that time was not like it is now, it was very small, and it was on their site too. So they sold their products, they made cakes, scones, whatever else, and it's just evolved since that time. And she kept on going, and they only had a few ladies at the time, so as it's all grown and grown, more and more ladies joined, and it became what it is now, a very well established and well known area of the hospital. Yeah.
My name's Bob Greaves. I'm a volunteer play specialist in the paediatric unit at Frankston Hospital. I started in 1980, not realising the hospital was only 40 years old at that stage. I wanted to get out and make a contribution to the community, so I came down here to the paediatric unit and met Helen for the first time and said, look, I've got an art background, can you use me? She said, yes, please. In 2007, I was awarded an OAM, Order of Australia Medal, for my work working with children in the paediatric unit at Frankston Hospital. Frankston Hospital has given me a great joy of life. I felt proud to be part of that team of helping Frankston Hospital and the community.
A very happy birthday to Frankston Hospital, 80 years old. It's kind of fitting, isn't it, that we're celebrating 18 years when in the next couple of days government will be announcing the winner of the Frankston Hospital redevelopment tender. An end of an era marked by a new beginning that we're all so very excited about. Of course, I don't have any detail at all at this time, but I'm sure you'll hear there'll be lots for us to celebrate in the coming months with an extraordinary redevelopment starting at our sites on the tennis courts. There are a few things that I wanted to reflect on over the past 12 months. First of all, our incredible workforce must be the first thing that I speak to, and Diana, of course, has already celebrated their achievements, but as me as the Chief Executive, I couldn't be prouder of the team and people that work in this organisation. It has been so difficult for the staff. We had 2020 and now 2021, and honestly, we all thought we'd be able to get a break and you know, take a deep breath for 2022, and Omicron arrived. Our staff have worked long hours wearing N95s, PPE, having to change and jump course throughout the past 2 years as we've learnt more about this virus. People have been seconded from their roles, and I could shout out to so many people, but look, the operating theatre team, thank you. They kind of put up their hand and jumped into ICU and gave our ICU team a hand over November and December, which was fantastic. Nurses have been supporting our midwives. Our allied health team have advanced practice and jumped into clinical areas that they haven't had experience in before. It has been an absolute team effort over the past 12 months to support and continue to provide excellent care to our community. Now to the current state. As you know, we're in a code brown pandemic for all health services. Of course, this was announced to let the community know that our health system is under particular stress at the moment. It's not only Omicron incredibly infectious, as I'm sure many of you have experienced. I'm sure there are a lot of you out there who have actually been infected by the virus. But since January, we've had over 650 staff infected as a result of community exposure. And there have been hundreds of staff furloughed over this time. With this many staff away from work, on top of a very busy year and the highest case number of COVID admitted to the hospital since the pandemic started, it has been an extraordinary job done by all to keep our services operating, and it's been an extraordinary job by the Victorian healthcare system. And I've never seen our health services working so closely together to ensure that we can provide care to the community. Our COVID positive pathways team have looked after thousands of people who are home isolating with COVID. They've been delivering thermometers, oxygen saturation monitors so they can monitor people's well-being at home. They have been bringing food from supermarkets to patients who haven't been able to get out to get food. And many of the team have been walking pets for those people who have been in isolation. I mean, such extraordinary effort done by that team. They established a Sotrovimab clinic so COVID positive people could access treatment quickly. Our Better at Home teams are providing rehabilitation, nursing, cancer care, maternity care and paediatric care in the home, which we plan to expand over the coming 12 months through our Better at Home initiatives. But how extraordinary the uptake of home care over the last 12 to 18 months, and our community love it. We can't take it away because we know you love it. I do acknowledge that it has been difficult for all those waiting for elective surgery. It hasn't been easy, and we are hopeful that we can get our elective surgery back on track and even bigger and better than before to try and catch up with those cases that we haven't been able to get on with. I do get often asked, what can the community do to assist us here at the hospital? And I say the same thing. If you could please get tested if you have got symptoms. Now do rapid antigen tests, but in particular get your third dose, get your booster. We are seeing that people who have had their booster are not ending up in hospital. People who haven't had their booster are more likely to need that added support, especially if you're older. It is so important that we get your booster, and our teams are available to help you get your booster. So what does the future hold? I mean, there's been so many amazing changes over the last 12 months. Certainly our traditional models of care have really been tested over the past 12 months. As I've already mentioned, home care, but virtual care has really picked up over the past 12 months. We've invested enormously in our staff being able to provide virtual care, and our community are embracing the opportunity to use technology instead of coming into our outpatient clinics. And even through COVID positive pathways, clearly there's opportunity there, even outside of COVID, to extend that model. Of course, we have a new hospital redevelopment on the way, but there's so many other projects. The Rosebud Hospital business case has been completed, which is great. We've been funded to develop a new mammography service here at Frankston Hospital, which is really driven by the community, absolutely lobbying for us to get that service on site. We're bringing new technology into the service, certainly advancements in all our imaging equipment, and we're developing better accommodation for our community mental health clients and staff. We are progressing with our digital health strategy, and during the pandemic we have invested heavily in supporting staff to provide care virtually through mobile technology and team platforms like you have watching us on today. We'll be investing in new chemotherapy prescribing and information system moving forward, and many other new systems to support care. Over the past 12 months we've implemented a new online learning system, the Learning Hub. The platform has over 150 courses available now, and a further 350 are being curated by our team and will soon be published. This brings our education and learning to all staff, no matter where they are working. One of our biggest challenges is, of course, the shortage of healthcare staff. This is a national problem. The pandemic has seen a lot of movement of staff either retiring or relocating interstate. We also rely heavily on overseas clinicians working holidays, which we haven't seen for the past 2 years. Investing in significant strategies to attract and retain a new workforce to the region is high on our agenda. The new infrastructure, of course, will help, but so does the emphasis on learning, innovation and ideas. We will come back to our new academic centre, Naranga, shortly, and we'll get an overview of our National Centre for Healthy Ageing. However, as I come to the end of my Chief Executive report, I'd also like to show you a video of our new Cancer Clinical Trials Hub down at Rosebud. This is just one way in which we're improving care for our people on the peninsula and working hard to continually innovate and improve our services. I've got a small video of our new Clinical Trials Hub for you. Thank you.
We're on the site of the Rosebud clinical trial with Peninsula Health. This room will have 6 chairs for oncology patients to be able to have their treatment here, to be able to work with their consulting clinicians on site without having to travel long distances. So this is being replicated around Victoria, in Latrobe, in Bendigo, in Mildura, expanding out to northern and other areas next year. And it's what we want to do around Australia, taking the trials to the patient, not the patient to the trials. So it's a $25 million program, but it's not the money, it's about equity and above all else, early treatment and saving lives.
This facility is just amazing. To be able to run clinical trials here, and patients are able to get onto clinical trials without having to travel to Frankston as well. And we hope that we're able to actually run more trials under Peninsula Health at Rosebud as well as at Frankston to be able to actually cater to the demands and the needs of the community.
Can I say the Clinical Trials Hub down at Frankston is such an enormous benefit for all our community down on the peninsula, not having to travel up to Frankston for cancer clinical trials, and also being able to access haematology, oncology outpatients down at Rosebud Hospital. So it's a fantastic investment and great for our community. To conclude my report, I'd just like to take this opportunity to thank our Chair, Diana Heggie, and Board Directors for their amazing support over the past 12 months. It's been quite an extraordinary year, a very difficult year, but throughout we have continued to work extremely well together in often challenging times, but I'm truly grateful to the Board Directors' insights, expertise and support. Finally, thank you again to each and every person who works with me, all volunteers alongside me at Peninsula Health. You have been amazing and I have felt your support throughout the 12 months. Of course, as Diana mentioned, we plan to have our AGM in person at the newly opened Naranga Centre. We're unable to meet in person, but we have asked our Professor of Research to present to us the exciting developments in the area of research and our partnership with Monash University. It is absolute great pleasure for me to welcome Professor of Medicine, the Director of Research and the Director of the National Centre for Healthy Ageing, Professor Balendai Srikanth. Thank you, Srikanth.
Thank you, Felicity. Health research and continuous education underpin many of the new treatments and models of care that we provide for our community. It is therefore my great pleasure to present to you the progress we've made this last year at Peninsula Health in achieving our strategic goals for research and education, and highlight some of the exciting developments on this front. Our 2021 research report has now been published with detailed information and is available on our website for you to see, and I invite you all to have a look at this. Overall, I'm really happy to announce that there's been significant growth in our efforts in research and education, in spite of the demands that COVID has placed on us. There's been a steady increase in the number of research projects conducted and a big jump in research funding to all our teams. And these are all measures of a really vibrant culture of innovation in healthcare. One of the most important research activities that a health service does is to conduct clinical trials of new treatments for various conditions so that our community can benefit. And I'm really pleased to report that our clinical trials units have participated in many more projects in 2021, even compared with the pre-COVID times. And this has particularly been the case for our cancer research unit, as you saw previously. Our cancer unit was the first in the world last year to recruit participants for a new breast cancer treatment, the first in Australia to recruit for a bowel cancer treatment, and currently recruiting the largest number of people in Australasia for bladder cancer treatments. With the addition of a new trial hub at Rosebud mentioned before, our cancer research team will provide a community with access to many more life-saving treatments and will go from strength to strength. In addition, and excitingly, as Felicity mentioned before, we have some great new developments happening in research into healthy aging. With the support of the Commonwealth Government, we and our university partner, Monash University, have invested significantly into developing the National Centre for Healthy Aging, which brings together national experts and healthcare consumers such as yourselves to lead the research into some of the biggest healthcare challenges related to aging. And these are supported by the latest in data and technology capabilities. In 2021, several projects were commenced by this National Centre, addressing important priorities in diverse areas such as mental health, dementia care, issues in residential aged care, and rehabilitation. We expect these projects to develop much needed improvements in the way healthcare is provided for our aging community, and I hope to report these outcomes to you at the next year's meeting. But finally and excitingly, I'm very proud to inform you about the completion of the Nunrunga Centre, a new facility for research, teaching and learning. This centre is a beautifully constructed building on the Frankston Hospital campus. It houses our clinical researchers, staff from the National Centre for Healthy Aging, and staff from Peninsula Health and Monash University. And I would like to sincerely thank and acknowledge the efforts of the board and the executive, along with everyone else who made this centre possible. But rather than me just speaking about this beautiful new centre, we have a video of the centre to play for you now, and I will leave you to enjoy viewing this new and exciting centre. Thank you.
Thanks so much, Srikanth. And the Narungga Centre really does highlight our objective of being innovative, leading education and ideas. And with you leading our research, leading the National Centre for Healthy Ageing, with all our fantastic researchers, I just can't wait to see what evolves over the coming years. So thank you, and thank you to all your team. I would like now to welcome back Diana to acknowledge our life governors. Thanks, Diana.
Oh, thanks, Felicity. An incredibly important part of our AGM is the recognition of our new life governors. These special awards recognise those people who have provided 10 years of voluntary service to Peninsula Health, a fitting acknowledgement for our wonderful volunteers. This year we have 11 awardees. It's a great privilege for me to be able to recognise our life governors here at the AGM. Your dedicated service is greatly appreciated by members of the board and by the staff here at Peninsula Health. As was the case last year, our volunteer and communications team have been able to create a short slideshow so that we can say an online thank you for your commitment to the health services over the last decade.
Thanks, Diana. And look, I just want to say thank you to all our life governors. We are now moving into our AGM. Thank you. We're now moving into our community forum. So I have had a few questions posted here down on the right-hand bottom of your screen. So if you just want to post any questions that you might have there, and I've got a few there already, which I'm just going to work through and answer, if that's okay with everyone. So the first one is, it's great that Frankston Hospital has been rebuilt, but can you please tell me what is happening with Rosebud Hospital? Yes, it is great that Frankston is being rebuilt. As I mentioned just briefly, is that the Rosebud Hospital business case has been completed and has gone up to government for consideration through the next budget round. So all the work's been done for government to give that consideration, and we're really hoping that they look on that business case favourably. So let's hope that happens for us. Next question was, I was COVID positive over Christmas, and so were my children. The COVID positive pathways was fantastic. Are you thinking about keeping programs like this even if we don't have COVID? Thank you for acknowledging that work. And like I mentioned, the COVID positive pathways team have done a great job in supporting people who are positive with COVID in our community. But it has been an extraordinary success being able to monitor hundreds of people in the community who are quite unwell. The learnings of that program will be built into our hospital in the home program, our Better at Home programs. We have learnt that with simple technology, we can work with people in the community to monitor their health and to have easy pathways to them to escalate concerns back up to us. So there's lots of opportunity, I think, to take those learnings forward in a number of programs in the coming years. I think I get asked this question almost every second day. When will visitors be allowed back into the hospital? We certainly want visitors back in the hospital. What we have been doing has been slowly increasing the number of carers that can come into hospital. So especially for those patients who have had extended lengths of stay in the organisation or needing care, who really do well with having some family support. We are working through the rapid antigen testing process and how we can manage visitors using rapid antigen tests. We're just waiting on a good supply, and then we'll start working through a process on how we're going to manage visitors. I think what we're seeing is that we're kind of feeling like we're heading into a COVID normal state where there's always going to be COVID positive people around. We're going to have COVID positive patients. We're going to have COVID positive staff who don't realise they're positive unless we go through a rapid antigen testing process, which is what we've been doing, and that's worked really well. But one of the things that we do need to be doing is working through how, sorry, I've just lost my screen, how we can manage more people in the organisation and how that's going to look. Is the mental health service part of the new Frankston Hospital? Yes, the mental health service is part of the new Frankston Hospital. It was a very late addition into the business case, but if I recall, it's at 50 beds. Both acute and aged mental health services will be part of the thinking, and the old mental health building is probably going to get knocked down to make way for the new building, because the new building will be down the front end or towards Yule Street, where the tennis courts are. So that area will be, but again, I don't have the detail. We'll have more detail when it gets announced, probably in the next day or so, I think, in particular as to who the winning respondent is. Next question. Does Peninsula Health have a plan to improve nutritional status of foods provided for patients, particularly in terms of low sugar, increased whole food options? As a health provider, Peninsula Health has a duty of care to ban sugary drinks, confectionery, high processed sugary foods, and educate on healthy alternatives, just as we ban smoking. Okay, I'm going to call in Helen, are you there? I mean, nutrition is sitting in your area. I think I might get you to answer that one for us.
Yeah, sure. Thank you, Felicity. I think I'm on there now. Yep. Yeah, look, I've been looking at this question, and thank you for flicking it over to me. It's a fantastic question. It's something we are all extremely passionate about here, bringing this in. I know our health promotion team are really keen to see this change and get rid of sugary products in particular. And I know our dietetic service and our dietitians are also really keen. So watch this space, because we will be moving on that. Thanks, Melinda.
Great, thanks, Melinda, for your question. Interesting. Another question here is, which mask do you recommend for the community? Shyman Menon, who is our Chief Medical Officer. Are you there, Shyman?
Thanks, Felicity. I'm here. Yes, I think at this stage, the CHO advice is wearing a mask in the outdoor setting. A well-fitting mask is the right mask to wear in your setting. So if the mask is sold, if the mask is contaminated, to change your mask. If you're wearing a disposable or a recurrent mask, make sure that you're washing your masks and it actually is well-fitting. There's a lot of discussion about P2 masks or N95 masks. They do offer a certain increased level of protection, but once again, it is actually ensuring that your mask is actually well-fitting is a major component when you actually are wearing a mask out in the community.
Thanks, Shyman. The next question I have here is, will the mental health beds have detox, so drug and alcohol detox beds? This is a really good question. The way the specifications have been written for the mental health beds, the answer is no. We don't have detox beds included in the specifications. But are we aware and do we acknowledge that we do need to have detox beds? Yes. There will be additional bed capacity in the new build, and we will go through a service planning process to determine what we use those beds for, but we're completely aware and also agree that there does need to be acute detoxification beds available in the area, and it's a conversation I've been having with the Frankston Council on numerous occasions to work on how we can progress that. So acknowledge the need. It's not part of the redevelopment per se, but there are additional beds within the redevelopment which we could consider using, but we just need to work through a service planning process on that. Another one. Hi, Felicity. What is Peninsula Health's commitment to the environment and sustainable energy options as part of the new build? Thanks. Gosh, that's a question close to my heart. Of course, I wanted to build the new hospital in straw, as a straw bar house, double glazed window, but we weren't allowed to do that. But can I say the specifications in the design were absolutely very concentrated on us meeting a high level of environment and sustainable energy requirements. Again, I don't have the detail. We will get the detail about exactly what's been included in the design, but the specifications were very specific about the energy requirements and the efficiency of the building. So once we get that information, I'm sure we'll absolutely be promoting hopefully how green this new build is. I can tell you it's not being made of straw bale or mud brick or anything like that, but I think it's going to certainly have a high level of rating for efficiency. But great question. And I suppose the other thing too, really push to get some, I want to say plugs, but for electric cars. I don't, so I think we want to be able to have all our fleet go electric and have staff who have got electric cars be able to do metered electric charging while they're at work. So that's something else that we're trying to build into the planning. So this is another question, is there anything exciting happening at Rosebud this year in terms of improvements? Oh, there's always exciting things happening at Rosebud. I mean, we did build the Cancer and Clinical Trials Hub, so that will open. We have also been doing some planning around road design. We get a lot of complaints and concerns from community and staff about how difficult it is to get in and out of the Rosebud site. And I can tell you, Point Nepean Road is a disaster at this time of year, trying to do a right-hand turn out of the hospital. So what people tend to do is shoot out the back and go out the side street, which upsets everybody on Braidwood Avenue. So we have got a consultant in who's doing a traffic management plan for us, and we are trying to work out whether we can put signalisation in at the Point Nepean Road end to try and widen out the roads a bit to allow better entry and exit on and off the Rosebud Hospital site. So like I said, we've got the consultant in, doing the plan, doing the business case, and then hopefully we can get that work done as part of some enabling work for a new hospital, because I think we'd have to fix the road and that whole entry and exit before we could build a new hospital. So it would be certainly enabling work for that work. I just double checking that there's no additional questions that anybody wants to ask out there. Doesn't look as though we've got anything else coming through. So look, I just want to say thank you for your questions. They were great questions. Again, thank everybody for their commitment and support of Peninsula Health and everybody that works here. Another shout out to all the staff. You do an amazing job. Thank you. And I will hand back over to Diana Heggie, who will close the AGM. Thank you.
Thanks, Felicity. And thank you for all the people who took the time to join us online today and for giving us your valuable insights and feedback. It's always great to hear thoughts and ideas on, what we could do better and what we are doing well. It's nice to hear both sides. So thank you for that. These are exciting times ahead for us all, which hopefully will include a much calmer 2022. And I look forward to continuing to work with you all over this coming year. Our annual report and research report are available online via our website. And if you would like to get a copy, please contact our communications team if you would prefer a physical copy. And thank you all again for your attendance at the AGM, and good morning. Thank you.